You need to talk to your lawyers. I may be wrong, but I doubt it. Let me go back to Professor Sood. Tell me two things you would do tomorrow to fix PBMs and result in lower prices for consumers.
Welcome back to America Mindset, the channel where we give you the real, unfiltered truth about what's happening in America. Today, we're diving into some of the most outrageous and revealing moments from a recent Senate hearing. Senator John Kennedy, one of the few voices of reason in Washington, didn't hold back when calling out the corruption and greed surrounding pharmacy benefit managers, or PBMs. Let me tell you, it's about time someone stood up for the American people and exposed the lies and manipulation in our healthcare system. Let's watch the video.
Thank you, Senator Cohen. Senator Kennedy.
Professor Sood, as I understand it, 80% of the PBM market is controlled by three companies, three PBMs, that are vertically integrated. Is that right?
That is correct.
Does your research show that the prices that consumers pay are higher than they would be if those companies were not vertically integrated?
So my research on Medicare Part D...
Give me an answer.
Partially.
What do you mean partially? They're either higher or they're lower.
So
There's no such thing as a partial price.
what I find is that Medicare Part D premiums are higher as a result of vertical integration.
Okay. Well, then why don't we, I'm all for transparency, Mr. Chairman, I want to say that. But why don't we skip the foreplay and go right to the sex and outlaw vertical integration for Part D? Would you accept an amendment to your bill like that?
I don't want to answer that question right now because I want to study that.
Would you support that, Mr. Scott? Let me just guess what your answer is.
No, sir, and I can explain why.
No, you speak Sanskrit. I mean, I'm sorry. You know, you're good at it, and I know your job is to protect the PBMs. And I might tell us I don't think PBMs are the only ones at fault, but you don't have unclean hands. Professor Sood, you say PBMs ought to be fiduciaries. To whom?
To both the plan and their members.
Well, what if the plan and the members' interests diverge? Who are they fiduciaries to?
Ultimately, in principle, they should be fiduciaries to the members.
Okay.
So, for example, ERISA makes...
I get it.
Okay.
I get it. Mr. Chairman, again, why don't we skip the foreplay and go right to the sex? Why don't we just amend your bill to require that PBMs have a fiduciary obligation to plan members?
Well, I think that's been suggested, and I think there's part of that in our legislation, but probably not fully enough to satisfy you.
Well,
So let me look at what you want to add to it.
okay. I mean, I'm not criticizing your bill. I don't want my office to end up in Bethesda. So I'm not criticizing your bill. I like transparency. But we're just nibbling around the edges here. And with respect, Mr. Scott, your definition of a fiduciary is wrong. A fiduciary isn't somebody that controls the decision. You know that, and I know that. A fiduciary is somebody who has a legal obligation to give his client the best advice and to do what's best for his client. It doesn't replace agent with principal or vice versa. You know that, and I know that. Well, you need to talk to your lawyers. I may be wrong, but I doubt it. Let me go back to Professor Sood. Tell me two things you would do tomorrow to fix PBMs and result in lower prices for consumers.
So I think the two things I would do is...
Very specific.
Yes. I would implement price transparency so that everyone knows what they're paying. And
Okay, price transparency just tells us who's screwing them.
Yeah.
Okay.
And then the fiduciary responsibility says, if you're getting screwed, I can take you to court. So I would do those two things. And those are, I think, better than, banning particular practices, because otherwise it's whack-a-mole. You ban spread pricing and something else will show up
Okay.
a year from now.
I got 29 seconds. Do you have any other suggestions? I appreciate your
So
straight talk.
the other thing we can do is what I recommended is pass-through of rebates to patients. So suppose a drug...
Say that again?
So pass-through of rebates to patients. So for example, the list price of a drug is $50,000, but the rebate on the drug is $40,000. So when a patient is paying cost sharing, suppose 10%, they should be paying on the post-rebate price. So which is the $50,000 less the $40,000 rebate. Right now, what's happening is patients are paying cost sharing on the $50,000. So this would immediately lower patient out-of-pocket costs. So as Dr. Kircher said, for the cancer patients...
So you're saying the number after us, the PBMs are jacking up, are encouraging manufacturers to jack up the list price so they can jack up their rebates.
And that...
Is that right?
Yes.
That's illegal.
And the jacked
That's
up...
illegal.
Yes. I don't know about that, but it...
I do.
Okay.
It's illegal as hell.
Yeah.
Before I call on Senator Ronald, want to remind my members we got a vote and they're enforcing the 30-minute rule. So I'm going.
So, here's the deal. 80%, yes, 80% of the PBM market is controlled by just 3 companies. These are vertically integrated behemoths, meaning they control multiple steps of the pharmaceutical supply chain. Now, Professor Sudd, one of the experts at the hearing, confirmed this. And what does that mean for us, the consumers? Higher premiums, higher drug prices, and more money in their pockets. That's right, they're profiting off your pain and suffering. This isn't capitalism, folks. This is crony capitalism. This is a rigged system where the government looks the other way while these corporations rob hard-working Americans blind. You think they care about your family's health? No, they care about their bottom line, and they'll use every trick in the book to squeeze every last penny out of us. Now, here's where Senator Kennedy comes in. And let me tell you, I love this guy. He's blunt, he's honest, and he's not afraid to call it like he sees it. At one point, he said, and I'm quoting here, "Why don't we skip the foreplay and go right to the sex?" Now, before anyone gets offended, let's be clear. He's saying, let's stop beating around the bush and outlaw vertical integration for Medicare Part D. He's saying, let's take action rather than nibbling around the edges. And you know what? He's absolutely right. But what does the chairman say? Oh, we can't do that right now because we need to study it more. Study it more? How much studying do you need to realize that monopolies are bad for consumers? How much studying do you need to see that these companies are driving up prices for seniors, cancer patients, and everyday Americans? This is why people are fed up with Washington. They love to talk, but when it comes to taking real action, they freeze up. And then there's this Mr. Scott, who's clearly there to defend the PBMs. Kennedy called him out, saying he's good at speaking Sanskrit, basically calling him out for talking in circles. Kennedy even said, "You don't have unclean hands." And that's putting it mildly. These PBM lobbyists are working overtime to protect their profits, not patients. They don't care if you can't afford your medication. They don't care if your grandmother has to skip doses because she's on a fixed income. They just care about the billions they're raking in. This is classic swamp behavior, folks. These lobbyists line the pockets of politicians, and then they get away with murder, figuratively, and, in some cases, literally, when patients can't afford life-saving drugs. Now, Professor Sudd brought up an interesting idea. He said PBMs should have a fiduciary obligation to plan members. That is, they should be legally required to act in their clients' best interests. Can you imagine? A company being forced to prioritize patients over profits? What a revolutionary concept. Of course, Kennedy jumped on this and said, why don't we just add that to the bill? But again, there's pushback. Why? Because the swamp doesn't want to hold PBMs accountable. They thrive on the chaos and the loopholes. And let me tell you something else. Kennedy is right to correct Mr. Scott's definition of fiduciary duty. It's not about controlling decisions. It's about giving clients the best advice and doing what's best for them. But the PBMs don't want that. They want to keep playing their shell game with rebates and list prices. Speaking of rebates, let's talk about one of the biggest scams in the system. Professor Sudd explained this perfectly. Here's how it works. A drug has a list price of $50,000, but there's a $40,000 rebate. Sounds great, right? Except patients are stuck paying cost sharing based on the $50,000, not the post-rebate price. So, all that rebate money, it's not helping you. It's going straight into the pockets of PBMs and insurers. This is highway robbery, folks. And Kennedy hit the nail on the head when he said PBMs are encouraging manufacturers to jack up list prices so they can increase their rebates. He even called it illegal as hell. And you know what? He's right. But what's being done about it? Nothing. Because the people in power are too busy protecting these corporations instead of protecting you. So what's the solution? Professor Sudd proposed two things: price transparency and fiduciary responsibility. And while those are great ideas, let me add this. We need to break up these monopolies. We need to outlaw vertical integration. And we need to hold these companies criminally accountable for their predatory practices. Enough is enough. This is about more than just drug prices. This is about justice. This is about protecting the American people from corporate greed. This is about standing up to the swamp and saying, we've had enough. Folks, if you're as fired up about this as I am, here's what I want you to do. Share this video with everyone you know. Call your senators and demand they support real reforms, not just nibble around the edges. And most importantly, stay informed. The swamp thrives in the dark, but together, we can shine a light on their corruption. If you're new to the channel, make sure to hit that subscribe button and turn on notifications. Here on American Mindset, we're fighting for truth, justice, and the American way. Thanks for watching, and I'll see you next time. God bless America.